Today we talk about when to hit the panic button when it comes to age and infertility. I'm Dr. Mark Amols, and this is Taco Bout Fertility Tuesday. Everyone has heard of the ticking clock. Every woman worries about their ticking clock. And today what we talk about is when is it time to panic and hit that panic button when it comes to age and infertility. If you had to guess a number, I'm pretty sure most of you would guess age 35. And that is actually a great guess. And as a matter of fact, it's a very good guess, but it's actually not correct. See, age 35 is a very good number. If you take everyone and lump everyone together, it's a decent number to use. Matter of fact, when it comes to the diagnoses of infertility, we even changed the diagnoses at age 35. Prior to age 35, as long as you've been trying for a year, we call it infertility. But after age 35, at that point, it needs to be 6 months, and we call it infertility. Now, why do we change the diagnosis? Well, it's really about at age 35, there tends to be a very sharp decline in our ovarian reserve for women. And with a decrease in ovarian reserve, it means it can be harder to get pregnant. And so if you are seeking fertility treatment, you will actually struggle if your ovarian reserve is low. And if you've heard some of my podcasts in the past, I talk about how prior to age 35, the ovarian reserve does decrease, but it's really when you hit 35 that starts to take a deeper dive. And by 38, that dive becomes very steep. But there's one part of this that's not as obvious, and that is ovarian reserve is a very good measure of how many eggs you can make when given a certain amount of medication. So as I've talked about this in my podcast, when I say who can make the most egg contest, that's what ovarian reserve tells us. But the question is, how important is the age portion? And what does the age mean when it comes to fertility? So let's define each of these. When it comes to ovarian reserve, we're referring to the number of eggs a woman has left and association with the quality of those eggs, but it doesn't actually tell you the quality. Quality is usually based off of age. And so what that means is a woman who has a better ovarian reserve at 38 will probably do better than someone who has a lower ovarian reserve at age 35. Now, I'm not saying that the person at 35 doesn't have better chances than the person at 38. They do, but the difference between 35 and 38 is somewhat small when it comes to quality. And so by being able to make a higher quantity, it helps that person at 38. So for example, if you were 35 and you can only make 6 eggs, and you're 38 and you can make 20 eggs, the person at 38 will actually do better. But where things are different is that at the 35-year-old, every egg they make will genetically be normal versus abnormal, statistically speaking. But at 38, statistically speaking, every egg will be more likely to be abnormal than normal. So it takes more eggs to overcome it. Now, when it comes to ovarian reserve testing, there are basically 3 tests that I've talked about in the past. The antral follicle count, which is where we measure up the follicles on the ovary. FSH levels, which are done on cycle day 3 to determine how hard the brain has to work to make an egg every month. And the last one is anti-Müllerian hormone, which gives a decent measure of kind of how much time you have left and overall, what is your egg quantity that's left. But there is a 4th part to ovarian reserve, and that is age. And what I mean by that is it's such an important part that we can't just look at the ovarian reserve. You have to also look at age. Meaning if your AMH level is 4, but your age is 44, your chances still are not great. It's probably going to take at least 2 IVF cycles to even have a chance. But if you're 21 with an AMH of only 1 or less, you probably will get pregnant even on the first IVF cycle or whatever treatment you end up choosing. And that's because the biological clock is a little bit more dependent on age. And the reason this is important is because when it comes to when to hit the panic button, it's not as simple as just a number. So the question is, could we come up with an algorithm that can maybe help us know if we need to hit that panic button earlier than age 35? So as I mentioned earlier, age 35 is a great number to use to when to hit the panic button. If you know nothing about your egg quality, if you know nothing about your ovarian reserve, or nothing about your family history, then age 35 is a good number. If you're 35 years of age, you know that your ovarian reserve is going to decline faster, both the quantity and quality of the eggs over the next 5 years, and so you want to hit that panic button. But today we're going to talk about what about hitting that panic button maybe even earlier. So some people in some cultures end up having significantly decreased ovarian reserve at younger ages. For example, people of Pacific Asian or Indian heritage experience a significant decline in their ovarian reserve by the early 30s, which means if they wait to age 35 to hit that panic button, it could already be too late. There are some people with family histories of women going to early menopause in their 40s, and for those women, they can't wait to age 35 to hit the panic button. They need to hit that panic button by age 30 or potentially even by 28 because there's this history of early menopause. Then there are environmental things that can affect fertility. So for example, if you've been a smoker through your life, we know that diminishes the ovarian reserve. And so I would tell anyone who is smoking, by age 30, you need to be hitting that panic button because your ovarian reserve is going to be less than someone who didn't smoke through their life. Even surgical management can sometimes cause decreased ovarian reserve. So if you're someone with, let's say, endometriosis, or has undergone multiple cyst removals on your ovary, there is a good chance that has affected the quality and quantity of the eggs in your ovary, and your ovarian reserve is going to be lower than someone who is age 30. And so you're going to want to hit that panic button by at least age 30 because you don't have until age 35. You need that head start to be able to improve things. Now, if you're someone who is, again, has no significant history, hasn't smoked, then it's not unreasonable to wait to age 35. But let's break down each one of these things. So let's start first with genetic predisposition. If you have a family history of early menopause, then you are going to want to start earlier and be hitting that panic button by age 30. Similarly, when it comes to ethnics, if you are Pacific Asian or Indian, again, by age 30, you need to start looking into your fertility. If there have been significant environmental factors, such as smoking or around radiation, or even things like chemotherapy treatment, then you absolutely need to be checking by age 30. And if you actually underwent chemotherapy, you need to be preparing prior to chemotherapy. And the last area I would say is going to be things like surgeries and certain medical treatments, which again includes chemotherapy. But if you've had surgery on your ovaries, especially if you had endometriosis or multiple cysts, there's a high chance you have diminished ovarian reserve due to the injury to those ovaries. And by age 30, you want to be hitting that panic button. Now, when I say hit the panic button, I'm not saying that the sky is falling, but what I'm saying is there's the potential that the sky is falling. And what you need to do is you need to now figure out where your ovarian reserve is. You may find out that you are sitting on a gold mine of awesome eggs, but you also may find out you're not. And that is going to change what you do and how fast you need to do it. The tests I would recommend are the ones I mentioned earlier: anti-Müllerian hormone, FSH and estrogen level on cycle day 3, and an antral follicle count by someone who usually does antral follicle counts in the follicular phase of your cycle. Using those parameters and your age, a specialist should be able to give you a better idea of what your fertility status will be over the next several years. And one thing we're going to talk about soon is how many kids you want also plays into this equation. If you're just wanting one kid and you have no infertility, even if your ovarian reserve is not that great, you really don't have to worry too much because as long as you're making 1 egg per month, you have a chance to get pregnant. But what if you want 5 kids? 6 kids. Well, waiting to age 35 will be difficult for anyone to try to build a family that high. So you would want to then start talking to someone by age 30. But especially if you have diminished ovarian reserve and you know you want a large family, you might want to be talking to someone sooner. Now, what about the situation if you don't have a partner? Well, this is exactly where egg freezing comes into play. We tell people that from a financial standpoint, you want to freeze your eggs by age 38 because after that, the quality goes down so much that's not as useful. But that is for the average person without these histories I've been talking about. So if you are one of those women who are thinking about freezing your eggs, but you have in your history surgeries, smoking, family history, or one of those ethnic groups, you might want to start earlier by at least age 30, or at least be tested to find out where your ovarian reserve is. So now that we defined when to hit the panic button for different groups, one of the things I have to talk about is how do you then measure over the years if you want to keep an eye on it? This comes from ovarian reserve testing. And so you can do this yearly before making a choice to freeze your egg. And I see women all the time who are worried about not being able to have kids, and maybe by age 20 or 30, they see me and they want to freeze their eggs. And I say, no, your ovarian reserve looks good. They're only wanting 2 kids. So I can keep following them, checking AMHs, let's say yearly, checking cycle day 3 labs maybe every couple of years, and even checking their antral follicle count, and can help them determine when to freeze their eggs and when to hit that panic button. But the thing that's important to understand is don't feel confident just because that ovarian reserve is good, because age matters. And so if you are 36, 37, 38, and you have a good ovarian reserve, you have to remember that that only tells you can get a lot of eggs, which will help you when it comes to fertility treatment. But when it comes to your best chances, age plays a big part in this. And so this is where you take how many kids you want to help you decide what type of treatment you want to do and how soon you need to do it. So if you're only wanting maybe a couple kids, you can just try on your own and then eventually do things like artificial insemination. But again, if you want to be the Brady Bunch and you're starting at age 37, probably the only way you're able to get a family that large is by either freezing eggs or making embryos, freezing them, and then in the future be able to put them back after age 42 when pregnancy becomes very difficult. So in summary, if you're 35, yes, you need to start hitting that panic button and figure out what you want to do if you don't have a plan. But if you're in one of those risk factors, such as a family history of early menopause or family history of people with low ovarian reserve, if you come from an ethnic group such as Pacific Asian or Indian background, or if you've had surgeries on your ovaries, whether it's due to endometriosis or due to cysts, and last, if there's some environmental factors such as smoking or even, as we talked about, chemotherapy, then you need to be hitting that panic button earlier. And for most people, I'd say by age 30 is a fair number if you have those risk factors. But for some of you, it might even need to be sooner. If you know that your mom went in early menopause, I would say at least a decade before they went into menopause, you should be evaluating this. In the end, the important part is make sure you hit that panic button in time so that allows you then to do the things you want. And part of that decision is how many kids you want. Whether it's doing egg freezing to be able to preserve your fertility, whether it's even embryo freezing. Don't be blinded by just a good ovarian reserve. You have to take age into account. You have to take how many kids you want into account. And you need to make sure you check earlier than age 35 if you fall into one of those groups. Hopefully this was a helpful podcast for some of you, and maybe you have friends who have been postponing having kids for some time and you think they might benefit from this podcast. Please tell them about it. And if for some reason you were just waiting to 35 to hit that panic button, but you fall into one of those groups, hit that panic button sooner and get in and see a fertility doctor or someone who can at least look at your ovarian reserve. As always, I greatly appreciate everyone who listens to this podcast. As I always say, if you like us, tell a friend about us. Give us a 5-star review on your favorite medium, but most of all, keep coming back. I look forward to talking to you again next week on Taco Bout Fertility Tuesday.